While it is important to be as positive as possible, being honest is even more important. If a student's not performing well, then you as an educator have to tell them that. However, you can try to be constructive, and you want to certainly be very specific about ways that they can improve.
Student performance appraisals don't have to be intimidating. They can be transformative. Today, we'll uncover the secret to turning evaluations into powerful, confidence-building tools that help nursing students thrive. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Today, we're tackling a topic that every educator wrestles with: student performance appraisals. How do we turn feedback into a catalyst for growth rather than a source of stress? Joining us today is Dr. Carol Huston, Professor Emerita at California State University, with over 30 years of experience, 7 books, and more than 150 published articles. Dr. Huston is a leading voice in nursing leadership and education. So get ready for practical strategies and insights you can use right away. So welcome, Carol.
Hi, Kelly. It's my pleasure to be here. Thank you so much for inviting me to be a part of this podcast and to have a chance to talk about performance appraisals as catalysts for growth.
Let's start by exploring the emotional terrain of student performance appraisals. They're often called student evaluations or student reviews. So why are performance appraisals so emotionally charged for both students and faculty?
It's a great question, Kelly. I think performance appraisals, when they're done correctly, are such a powerful tool for promoting personal and professional growth in students, but that many of us have had negative experiences in our own backgrounds where we were traumatized by a performance appraisal that was not done correctly. And I think then we carry that trauma forward. And although performance appraisal is such a great way to help students learn and grow both personally and professionally, it can also be very, very difficult. We know that receiving constructive feedback is always helpful for professional growth, but sometimes it doesn't really feel that way initially. We also know the process isn't easy. None of an educator's actions are as personal as appraising the work performance of others. So it often is one of the most dreaded tasks that a nurse educator faces. In many cases, the educator really dislikes the appraisal interview more than the actual data gathering. And that's because the opinions that educators have about students and the appraisals that we do have such far-reaching implications for a student's future career. So the goal for the educator always has to be to make sure that that appraisal is objective and systematic and formalized as it can possibly be. I think that recognizing that it's such an emotionally charged event, we also have to remember that it's still one of the greatest tools that we as educators have to develop and motivate students.
As we kind of explore these emotional dynamics, I'd love to delve into some common challenges that faculty face. What are some common pitfalls that you've seen in conducting performance appraisals?
First of all, I don't think that conducting performance appraisals is intuitive. It takes time and it takes effort and it takes practice on the part of the educator to really get that skill set honed. But I think the first thing that an educator should do is to really be aware of their own biases and prejudice, because that certainly can influence a performance appraisal. And while we recognize that all performance appraisal has some degree of subjectivity, there are things that we can do that will increase the odds that it's not only more objective, but that it's an accurate appraisal. So, for example, I often talk about 3 common pitfalls of assessment: the halo effect, the horns effect, and a central tendency error. So the halo effect occurs when you as an appraiser let 1 or 2 positive aspects about a specific student influence the entire evaluation. So everything is artificially inflated to a higher degree. We also see the same thing as far as a horns effect. With the horns effect, you allow some negative aspects, something about that student that just makes you a little crazy or something that's not in alignment with your own values. And it influences your assessment to the point where you're viewing everything about the student negatively. And then we have that central tendency trap. And with that, you just aren't willing to take the risk to step out there on either end of the spectrum. So all students are rated somewhere kind of right in the middle. And so we really aren't differentiating between the student's strengths and the student's weaknesses. I also think, particularly for novice educators, it's easy to fall into the trap of trying to measure intent and not actual performance. A performance appraisal always has to measure actual performance, or otherwise it's not going to be growth producing. That's how we learn and how we grow. You also, as an educator, will want to really guard against a bias known as the Matthew effect. And in the Matthew effect is when the same student receives the same appraisal time after time after time. And so those who perform well early in their nursing education will continue to perform well. And if a student had difficulty and that's shared with the faculty who follows, then it tends to be kind of self-perpetuating. So in other words, no matter how hard that student tries to improve their performance, their past performance appraisals kind of prejudice any chance that they have for future improvement.
I think understanding these challenges is definitely a key, so that we have our eyes wide open, just as you mentioned, the effects that can happen. What can we do to overcome them? So do you have any strategies faculty might use to increase the likelihood of kind of growth producing performance appraisals for these students?
I do. I think that one of the most important things is sometimes we save up all this feedback for maybe it's one appraisal per semester, or, we don't do day-to-day coaching often enough. So there really shouldn't be any surprises in an appraisal conference. I think effective educators really do coach and communicate informally with students on a daily or weekly basis, some kind of continual basis, so that there shouldn't be a whole lot of new or surprising information at an appraisal conference. I also think that while it is important to be as positive as possible, that being honest is even more important. If a student's not performing well, then you as an educator have to tell them that. However, you can try to be constructive, and you want to certainly be very specific about ways that they can improve by seeking a balance of positive and negatives whenever you can. But when you're delivering the actual performance feedback, you want to be straightforward and you want to state your concerns directly so that you're not clouding the message. Sometimes I see students leave performance appraisals and they're confused because the feedback they've gotten is kind of vague, like your skills need a little work or your performance is probably okay. Well, what does that mean? So you want to be prepared with some explicit performance examples, and you want to be liberal with the use of your positive examples of their performance, and use examples of poor performance more sparingly. We don't need to just keep barraging students with all the things that they do wrong. Typically, a couple comments will do it, and asking the students if they understand the feedback that you're giving them. You also want to make sure that you're focusing on the student's performance and not their personal characteristics. And sometimes, those two can become kind of merged. You also just have to be aware that there's some status differences between you and students. And that alone is going to impede any kind of open and honest communication, particularly coming from the student to you. So I'm not saying that educators shouldn't maintain some kind of an appropriate authority power gap with their students, but you do have to realize that power and status can be influencing, how honest the exchange is between you and the student about their performance. And then I guess the last strategy that I think is really important to remember is that you should probably plan on being available for students to return after the conference to talk about what you had to say to them. I think sometimes it just takes a while to process information and to reduce kind of the emotionalism of the event. And that's particularly true if the conference didn't go very well or the student was given some kind of unexpected or new information.
I really like how you said really embedding that day-to-day kind of feedback with the student. It shouldn't be a surprise. And having that conversation with the student in a very authentic way. And my personal belief is that you can't change something that you don't know about. And if you can really articulate, the great things that the student is doing, and here's some feedback and room for improvement, and being very clear on what that is, the timeline and the expectations and whatnot, because again, they can't change something that they don't know about. I think that's really important. So I like what you had to say about that for sure. So can we talk a little bit, Carol, about the environment in which these appraisals take place? How can faculty create a positive environment that really supports that constructive feedback?
I think constructive feedback is just truly such a gift. And I think that certainly not often enough in our lives do we have the opportunity to get true, meaningful feedback that helps us to grow and learn. But at least initially, sometimes that feedback is not perceived in the way that we would certainly hope that it's perceived. So there are things that you can do to create a more positive environment to support that kind of constructive feedback. I think, first of all, students really have to believe that the appraisal tool is based on a standard to which all the students in the same classification are held to. So in other words, everybody's given the same criteria by which they're going to be judged, and that the students know what those are ahead of time. I also think that it's so important that the appraiser be someone who has directly observed the student's work. And it should be someone that the student trusts and respects. And that seems just like common sense. But all too often, we will shunt a performance appraisal off to a preceptor. And the preceptor probably, does work very closely with the student, but may not know all the facets of the student's performance like the educator does. You also want to make sure that that appraisal is held in a really private, quiet, and comfortable place. I think that I've seen sometimes faculty do performance appraisals standing at the nurse's station or in the hall, and it sends a couple covert messages. One, that the appraisal is not that important. And two, that nothing of substance is going to be said that can't be overheard by somebody else. So you want to make sure you're scheduling uninterrupted appraisal time and that you allow enough time for you not only to give feedback, for you to hear feedback from the student about the feedback that you've given. So listening carefully to what the student has to say and giving them your full attention is just absolutely critical to have a positive environment.
Student involvement is another critical factor. So in what ways can students be actively involved in their own performance appraisal process?
Well, there always has to be some effort to include the student's own appraisal of their work. Oftentimes, you can ask the student to complete the same appraisal tool that you as a faculty member are using and to bring it with them to the appraisal conference. I think it's really nice if students do this before the conference because it makes them spend some time reflecting and thinking about what it is that they want to share and how they feel that they have met the objectives. I have seen faculty have students write it out in a journal. That's another possibility. And sometimes faculty will just say, come with your ideas and we'll discuss it in person. But I do think that reduces the probability that they're going to spend a lot of time in reflection before they come. Self-appraisal, though, isn't easy. And I think it's particularly hard for students. And it goes back to that power gap, because most students are afraid to overrate themselves. So they tend to give themselves lower marks than what they really think that they have earned. It's really hard for them to find that right balance of recognizing their achievements without bragging and also of admitting their shortfalls for fear that it's going to lower their grade. So I think having a discussion with students even before the appraisals begin about viewing the self-appraisal as an opportunity to honestly showcase their achievements, as well as to identify areas of potential growth. It just kind of de-escalates some of that trauma and nervousness that goes into a performance appraisal. I also think it's important for faculty to complete their appraisal of the student, at least in a draft form, before reading the student's self-analysis. I know that it's very easy to be influenced by a student who gives themselves all highest marks all the way down the appraisal tool when I have perhaps more mixed kind of reviews on some of the criteria. So I always try to do my draft first, and then I read the student's feedback ahead of time and then look to see if I've been biased or prejudiced in some way, or if I missed some critical examples. And I do think it's important for students to provide specific examples on their self-appraisal of particularly the areas where they have given themselves a really high score. And then I think also when there are really significant discrepancies between the student's self-appraisal and what the faculty member has marked on the appraisal, then you really need to make sure you've allowed time during the conference to talk about why those differences are there. That kind of discussion can help really provide some valuable insight to not only the student, but also to you as an appraiser in terms of making sure that you've been inclusive of all the information that was available to you.
I think of the first time or two that I had done performance appraisals for students, and I remember being new faculty and quite nervous about these are the things that I need to say to the student. They're doing quite well in this area, but here's some areas of improvement. And I remember thinking, I just need to maybe do role playing, or if you look at Dr. Cynthia Clark's work in cognitive rehearsal, is to be able to set up in your mind, clearly articulate what you need to say to that student, and then also kind of set it up from the beginning. On day one of the class, I would come in, and I had learned this strategy from Dr. Susan Lupperell too, out in Montana. She had said to ask your students, how many of you are hoping to become a mediocre nurse? And of course, all the students, they're not going to raise their hands, right? How many of you are going to want to be a highly competent nurse? And everybody raised their hands. Yes, I want to be a highly competent nurse and very effective and, meet the needs of my patients. And then she would go on to say, I trust that you want my feedback to help you achieve your goal of being highly competent, and thus kind of honor you by sharing my observations and my feedback. And I ask that you trust that that is going to be my sole purpose for sharing both positive and constructive feedback, is to really help you achieve your goals. And kind of leave it like that on the first day of class and set it up. I'm going to be giving you constructive feedback because you want to be a competent nurse. And then later in the semester, when you do give that feedback, to kind of recall that conversation and say, remember the first day that when we talked about the role of trust and giving feedback? I have some feedback for you that I really want to share now that may be a little bit difficult to hear, but please know I'm sharing it with you so that you can meet your goal of becoming that competent nurse. And I felt like that was really a good way to kind of set up that class to know this is what you can expect, and that I want you to be wildly successful. And therefore, I will be giving you some constructive feedback so that you can essentially achieve your goal. So
to me, it's about having some kind of trust between you and the student, that the goal of the performance appraisal is not just to identify their shortcomings, but rather to have some kind of a constructive dialogue about what they do well as constructive feedback about how they can improve their performance. So there has to be some kind of a trusting relationship, that the intent of the performance appraisal is to help them become a better nurse or a better student, or, whatever it might be.
And I think of that long-term impact. You kind of touched on this as far as performance appraisals being structured in a way that will help grow that student. How can they really assess that student and also inspire them and motivate them to continue to dig into the materials and continue to grow? I guess my question is, how can these appraisals be really structured to not only assess, but also inspire and motivate our students?
I think that the data gathering that you do for a performance appraisal is just absolutely critical. You have to make sure that you've kept some accurate records and that you've used as many sources as possible in gathering that kind of data. If you don't keep notes for the entire period of the appraisal, then you're going to have something we call the recency effect, where perhaps the student's done well the entire course, and then at the end they make a medication error or they do something that raises some concern. And then sometimes that unduly influences all the rest of the performance appraisal. So gather the data appropriately. I would also say that negative information is weighed more heavily than positive information, especially when it's been recent. So again, gather it over the entire time period. Make sure that you have a tool that measures what you want it to measure. So oftentimes faculty will use their course objectives as the criteria upon which the student is assessed, but those also need to be measurable. Take a look at the tool you're using. There are lots of tools out there. I think that many faculty will use some kind of a checklist or a trait rating scale or some kind of a anecdotal or free-form essay. It doesn't really matter what kind of tool that you're using, but make sure that you use as many sources as possible. Certainly you have your own direct observation, but if it's a performance appraisal for a student in a clinical setting, talking with the student's preceptors or with the nurses that the students have the opportunity to work with, I think is really helpful. If you have your students working in pairs, certainly I would not be asking one student about another student's performance, but often there's a debrief in which students can talk about the success of their dyad. So just the more sources that you can use, the better, and making sure that the data really reflects the entire time period of the appraisal. I think when you really do keep good notes or records, that there's nothing that delights a student more than discovering that the faculty are aware of their growth, that the faculty are noticing when they do good things, and that the faculty member can cite, specific instances in which they display good clinical judgment or their accomplishments. Far too often, I think the data we collect really focuses on the negative aspects of performance. So make sure when you keep those notes that you're identifying both achievements as well as areas for performance improvement.
I'm wondering your thoughts on inter-rater reliability. You have, let's say, a new faculty coming on. They're coming from practice, which they're amazing clinicians, but the role of the nurse educator is new. They're just learning how to appraise student performance. And have you seen maybe a best practice for new nurse educators coming in to academia to really learn how to do effective performance appraisal using the strategies you've kind of mentioned? And how do they know they're doing it right, per se?
I think you're right. There certainly is a great risk that inter-rater reliability is going to be pretty low, particularly when you're first starting. That subjectivity element is just so critical. So I think all educators need mentors, and having the opportunity to be mentored by another experienced faculty member who can certainly help you look at what kind of language, what kind of examples you're using, how they perhaps keep the record keeping for their performance appraisals could be just really helpful. And I think if you are anticipating a really highly emotionally charged performance appraisal, particularly one that might involve a disciplinary issue or potential suspension or termination from a program, that it's really helpful to make sure that you review that or discuss your plan with a more seasoned academic professional. It's so easy to be caught up in the emotional aspects of the performance appraisal, particularly if it's not going well. And it's important to be calm and to be clear and to be direct about the message and to really have thought about it ahead of time. So having somebody that you can run that by and guide you and coach you as a nurse educator is really important.
I've had that same experience as a dean where it would escalate to my desk and I'd have to kind of tease out the situation, and gather the information from not only the faculty, the student, maybe the clinical preceptor. And like you said, documentation is the key, but also making sure that the student is well aware of their performance and how it aligns with the objectives of the course, et cetera, throughout the semester, not just midpoint or at the end.
It also kind of reaffirms the need that if you're going to give some concerns or provide negative comments, that you should be able to provide an example or two. You don't need to hit the student over the head, with many, many examples, but you need to be able to give them a specific example of why you have scored a student in the way that you have.
As we wrap up, Carol, today, what is one final spark, maybe an empowering thought or idea that you hope will resonate with our listeners?
I think it would be that constructive feedback really is a gift, and that it's the greatest tool that nurse educators have to motivate students and improve their performance. But there are things that you as an educator can do to increase the likelihood that it will be successful. That's creating that positive environment and involving students in the process and giving clear, objective, and accurate feedback. That all of those things really can turn student performance appraisals into catalysts for growth.
Thank you, Carol. I appreciate you sharing your valuable feedback and insights today. So today's episode really highlighted the transformative power of feedback in nursing education. And listeners, I hope you feel inspired to rethink performance appraisals as opportunities for growth. So thanks again, Carol.
Thanks, Kelly, for having me here.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.